Hello, welcome everyone. Good morning, good afternoon, depending on where you are today. We are just going to give it another minute for some attendees to join, but thank you all so much for setting aside the time to talk to us today about the Connect and Protect Law Enforcement Behavioral Health Response Program orientation. All right, well, I am mindful that we have quite a bit to get through today, and I'm seeing folks join, so I think we are going to get started. Yes, I see our attendees joining us. Well, thank you today, like I said, for joining the FY21 Connect and Protect Law Enforcement Behavioral Health Response Program orientation. Today's webinar will focus specifically on the Connect and Protect grant track of the Justice Mental Health Collaboration Program, also referred to as JMHCP. And sometimes you'll see I will call Connect and Protect C&P as a loving referral. My name is Julia Kessler, and I am the program manager for the law enforcement team at the Council State Government's Justice Center, and I will also be overseeing this grant track. Today, I will be moderating today's webinar, which is hosted by the U.S. Department of Justice, Bureau of Justice Assistance, BJA. Next slide, please. Before we get started, I just wanted to give you an overview of what we'll be discussing and sharing today. First, we'll be doing some welcoming and introductions of our presenters, and then we will hear from BJA, who will provide an overview of JMHCP. We will then discuss Connect and Protect grant requirements, introduce you all as a cohort, provide some additional detail on training and technical assistance that you can expect from this track and from us at CSG. And then at the end of the webinar, we will hear from two of our past JMHCP grantees and also part of this Connect and Protect cohort, who will be sharing their experience, best practices, and some just recommendations to you all as you start implementing your grant. Finally, there will be time for questions and answers at the end. And I just want to open it up with some housekeeping. So anytime throughout the webinar, you can ask a question by either clicking on the Q&A button at the bottom of the screen and entering your question, or by chatting it. And I think you've already seen, yes, thank you, some technical information being sent through the chat box. So again, if you have any questions, please send it through there. We won't, depending on time, we won't be able to answer questions as we go, but we will be reviewing those at the end. If you encounter any technical or audio problems during this webinar, please click on the links that were just sent to you all. Some technical issues won't be able to be resolved immediately, but I do just want to remind everyone that this webinar is being recorded, and we will be posting it for you to review later on for anyone that maybe has to drop out midway for technical issues or wasn't able to join today. Next slide, please. All right, so we have quite a long list of those that I'd like to introduce today, some of our presenters today. First off, I'd like to introduce Maria Fryer, who is a Justice Systems and Mental Health Policy Advisor with the Bureau of Justice Assistance, U.S. Department of Justice. Maria Fryer is a policy analyst for BJA. She oversees the justice and mental health portfolio and collaborates with the CSG Justice Center to assist states, local government, and behavioral health organizations to better understand the relationship between the criminal justice system and mental health populations, and to create policy and programming that meets the needs of municipalities and the citizens they serve. Maria Fryer previously worked at the North Carolina Governor's Crime Commission, where she advised the governor's office on effectively addressing the needs of victims of violent crime. In addition to working with families overcoming violence and instability in Coffee County, Alabama, Maria has worked in community corrections in Fayetteville, North Carolina, helping to develop intermediate and community-based sanctions for those with drug addiction. She also served in the United States Army as a member of the Military Police Corps. So thank you, Maria, for joining us today. We're very lucky to have you on. I'd also like to introduce our presenter from the Colorado Division of Criminal Justice, Peggy Hale, or Margaret, but she goes by Peggy. She joined the Office of Research and Statistics as a behavioral health specialist in 2014. Peggy is a licensed clinical social worker with over 30 years of experience in criminal justice, behavioral health administration, service delivery, and research. In her current position, she promotes effective interventions for justice-involved individuals with behavioral health needs by facilitating policy and research development through the coordination of behavioral health related grants and participation on multiple behavioral health related boards and committees. Welcome, Peggy. We're also very excited to hear from you at the end of the webinar today. Our other panelist from Boston Police Department, Deputy Director Jenna Savage, is with the BPD's Office of Research and Development. Ms. Savage has provided leadership to Boston Police Department since 2009 and has supported them through the implementation of many JMHCP grants, which she will talk about a little later today, and brings to the program considerable experience with problem solving and cross systems collaboration building. And so now I'd like to introduce our TA coaches, who will talk a little bit more about what a TA coach is, but those key individuals that make up our team at the CSG Justice Center. We have Deirdre Say, Laura Fabius, Ethan Aronson, Rachel Lee, and Ethan Kelly, some of whom you can see on the screen, but for those of you who you can't, welcome everyone. I know I couldn't do my job without you all, and it's great to have you here. And you already met me. I'm Julia Kessler, project manager, and I will be overseeing this grant. So we have a lot of folks that will be sharing today, and we're very excited to have on. But can you go to the next slide, please? Now I will be transitioning it to Maria, who will provide an overview of BJA. And with that, next slide, please. So Maria.
Great. Thank you so much, Julia. Hello, everybody. Welcome. My name is Maria Fryer. Thank you for the introduction. And I'd just like to tell you a little bit about the mission of BJA. And at BJA, our mission is to provide leadership and services in grant administration and criminal justice policy development to support state, local, and tribal justice strategies to achieve safer communities. BJA works with communities, governments, and nonprofit organizations to reduce crime, recidivism, and unnecessary confinement, and promote a safe and fair justice system. Specifically, BJA provides funding to support law enforcement, combat violent and drug-related crime, and combat victimization. And through the development and implementation of policy services and sound grant management, BJA strengthens the nation's criminal justice system and restores security in communities. As recipients of this award, you each share a common goal to effectively serve people with mental health conditions and co-occurring disorders in your local jurisdictions through law enforcement and behavioral health partnerships. This is an outstanding goal, and we are so very excited to have your support. I work in the policy office as a policy advisor for justice systems and mental health at the Bureau of Justice Assistance, and I oversee a number of programs pertaining to the intersection of mental health and co-occurring disorders with the criminal justice system, including the JMHCP, under Connect and Protect under the JMHCP, and our law enforcement work. And that's what this program is specifically geared towards, is all of you in law enforcement and your behavioral health partners. We are a small and dedicated staff here at BJA, but we work very hard to translate best and promising practices into quality policies and programs for the criminal justice field. Thank you so much, Julia. Get back to you.
Thank you, Maria. Next slide, please. So now I'd like to give some background on CSG. The Justice Center is a national nonprofit, nonpartisan organization that combines the power of membership membership association representing state officials in all 3 branches of government, with the expertise of a policy and research team focused on assisting others to attain measurable results. Our staff develops research-driven strategies to increase public safety and strengthen communities. Next slide. This slide describes a bit more about how we work and our style and how we strive to reflect the Justice Center's core values, which include a commitment to being independent and nonpartisan in every aspect of our work, providing rigorous, trusted, high-quality analysis, developing practical and innovative solutions informed by data and research, promoting collaboration and building consensus, and of course, being inclusive and respectful of diverse views and experiences. Next slide, please. As was shared with you during your orientation webinar, I just wanted to bring this all up, but the goal of JMHCP grant program overall is to develop collaboration across the criminal justice and behavioral health systems from law enforcement, pretrial, courts, jails, and community supervision. To learn how to have a successful partnership that increase efficiencies and improve public safety and outcomes for people with mental health conditions or co-occurring substance use disorders in the criminal justice system. Next slide. Throughout JMHCP's life, there have been over 600 awardees across the nation, which is incredible. It represents 49 states and 2 U.S. territories with $189.6 million awarded. So that is an incredible amount to support the field in innovative and best practices. Next slide, please. So now I would like to transition a bit to discuss in further detail about Connect and Protect. I will transition it back to Maria.
All right, great. So as we mentioned, the Connect and Protect grant track or program is essentially a part of the JMHCP or the Justice and Mental Health Collaboration Program, but it is its own specific program specifically geared towards law enforcement and behavioral health partnerships. And with this focus on these partnerships, you all were selected to receive grant funding specifically because you demonstrated a commitment excuse me, to implementing innovative programming that advances law enforcement and behavioral health cross-system collaboration to improve public health and public safety outcomes and responses for individuals with mental health and co-occurring mental health and substance use disorders who come in contact with the criminal justice system. Your grant programming has the following objectives. Next slide. To plan and deliver a law enforcement agency response program in coordination with a mental health agency and with advocacy or other community services, such as peer support specialists. And these services can help and improve and enhance the response. Also to pay salaries, as well as other expenses such as training. A lot of agencies ask about overtime. Overtime is totally allowable, and coordination activities to design and implement a police mental health collaboration program. Another objective is to conduct an evaluation of your police mental health collaboration program and to determine community satisfaction and use that evaluation to help inform and improve your program, and also to engage citizens through officer outreach and education to improve public safety. We have some more objectives. Next slide. And just to continue, the program is also intended to build positive community relations and trust through public communication strategies, enhance officer knowledge and skills in responding to community members who have mental health disorders and co-occurring mental health and substance use disorders. So here you'll see that the acronyms say MI and CMISA, but we have become a little bit different in how we use our language around referring to people with substance use disorders, and specifically, we do have a style guide around this, and it's specifically now a little bit more person-centered language, and so I just want to make that correction and draw that to your attention. So we refer to people in person-first language, And we also use acronyms such as mental health disorders and mental health substance use disorders. And also, we also are looking to increase public safety and capacity to develop and sustain the program by collecting data to inform practices, stakeholder groups, policy development, and ongoing professional development. Next slide. And as you look forward to getting started, so that, as Julia likes to refer to it, the CMP grant track has two-phase process to planning and implementing your activities. The planning phase is up to 12 months, and the implementation phase will begin once the grantee's planning and implementation guide is completed. So we'll talk a little bit more about the planning and implementation guide a little later in the orientation. You will also be connected with a TA coach, and your TA coach is like a central hub for your team, connecting you with resources and activities and things that are happening at CSG, BJA on the national level. They will be your go-to person, and they will help you plan your technical assistance plan, and help you with your goals and objectives and your planning and implementation guide. Next slide. So a little bit about budget planning. All of you should structure your budgets to allocate a portion of the budget up to $100,000 of the total grant award to complete phase one. And this is the planning phase. This is critically important to setting your program up for success once you begin to implement. With your planning and implementation guide, which we'll talk about in just a little bit, it's completed and then must be approved by BJA, and the rest of your grant funding will then become available. So you have the first up to the first 12 months to complete the guide and access to $100,000, and then after the planning guide is reviewed by your TA coach, sent on to BJA, and then myself, I will read and approve it, and then along with your policy advisor on the BJA side, on the programs office side, and then the rest of the special condition will be released, and your funding, the rest of your award will be released. So, all right, well, thank you very much. Talked to you a little bit about overview of the program, and now I would like to just go ahead and give it back to Julia.
Thanks, Maria, so much. Eunice, you can go to the next slide. So thank you, Maria, for setting us up. We're going to be talking about all of those things in more detail later on. But before we do, we are very, very excited to have you all together today, and we'd like to introduce you all as a cohort, since you will all be interacting with each other quite a bit throughout the next few years as a community and supporting each other and learning from each other. With that, I'd like to turn it over to members from the law enforcement team to introduce you all. Because we have such a big cohort today, we ask that you just say hello in the chat as you are introduced, but I can promise you there will be more opportunity for connections, and you're doing cross collaboration locally, but also cross collaboration and learning between you all as we implement your programs. So with that, I will turn it over to the next slide to your TA coach, Ethan.
Good afternoon, everyone. So we've got a number of grantees here. I'm just going to quickly go through what they are focused on. And as Julia said, you can say hello in the chat. So first we have Anaheim, California, which is going to be planning, implementing, and evaluating the community care response team. And they are also going to be working with the homeless outreach team officers. In Boone County, Illinois, they will be developing a behavioral health component to the support outreach recovery team. In Boston, Massachusetts, they will be hiring a full-time master's level best clinician, as well as evaluating the program's effectiveness. In Cape Girardeau, Missouri, they're developing a co-responder program training for 911 dispatch, as well as putting together a peer support for debriefing officers following critical incidents. In Carrollton, Georgia, they are expanding existing Carroll County response teams, a corresponding mobile crisis unit that is dispatched by Carroll County 911 system. And if we could move on to the next slide. All right, in Chicago, Illinois, the grant team will support collaborative clinical support program in partnership with the National Alliance on Mental Illness. In Colorado, the Colorado Department of Public Safety will create interactive web-based planning and decision-making tools. They're going to develop specialized program response registries, an interactive map, as well as some e-learning courses for emergency responders. In Conway, Arkansas, they are implementing 2 co-responder teams, which will include a social worker and a law enforcement officer. In Dalton, Georgia, they are planning and implementing the co-responder team in partnership with their local community service providers. And in Durham, North Carolina, they will be working to develop and implement the pilot program, Crisis Advocate Response and Engagement Initiative, as part of a crisis call diversion program.
Thank you, Ethan. So now I would like to turn it to Laura.
Sorry, 2 years later, and I still get caught up with that mute button. Hello, everyone. I'm Laura. I'm a policy analyst here on the law enforcement team. The Frederick, Maryland team, apologies, I know it's Maryland, not Massachusetts. They're going to create a mobile crisis team that partners with the Frederick police officers and mental health professionals. Kalamazoo County, Michigan, they're going to create a police mental health cooperation program, which will include hiring a coordinator to manage a coordination of multiple stakeholders. Los Angeles, California, the mental evaluation unit will identify high utilizers and use existing programs to address their needs. In Miami, Florida, implement a high utilizer intervention program, pairing a law enforcement officer and a clinical social worker to proactively engage the top 100 frequent utilizers of emergency services. Multnomah County, Oregon, they're going to develop the Behavioral Health Connections, BAC program, to increase screening, referral, comprehensive care management, and outreach services across the county. Next slide, please. In Newcastle County, Delaware, and NAMI, Delaware, they're going to expand the current CIT training to other departments while developing standard CIT policies and procedures for officers and agencies. A needs assessment will be conducted to better understand community perception of mental health and police involvement. In Pasco County, Florida, they're going to embed intervention specialists in the call center for early engagement and de-escalation with people experiencing a behavioral health crisis. Pine Belt, Mississippi, they're going to expand the co-responder team to the Hattiesburg, Mississippi area and hire a mental health clinician and community support specialist for their mobile crisis response team. Richmond, Virginia, they're going to enhance programming to support high utilizers of emergency services by establishing a co-responder team and incorporating peer recovery services into their response. And Rowan University, New Jersey, and the Atlantic County Sheriff's Office, New Jersey, they're going to develop the Project Hope response system, form the CRT team with the CIT officer and a social worker, and train officers on CRT and CIT. All great projects. Next slide.
Hi everyone, I'm Deirdre Assay. I'm a senior policy analyst on the law enforcement team, and I will be rounding out the group of sites. So Shoreline, Washington will be providing additional co-responder capacity to the radar program, as well as a full-time treatment navigator. Stamford, Connecticut will expand the local behavioral health unit and hire a second social worker dedicated to juveniles and a part-time social worker to cover evenings and weekends to ensure full-time coverage. Suffolk County, New York will develop a 911 diversion response model to increase access to treatment for individuals who have frequent contact with emergency services. Sumter County, Florida will implement a co-response program to bring together crisis intervention specialists and officers. Tennessee State and NAMI Cookeville will implement a crisis assistance helping out on the streets or CAHOOTS model pilot program in Cookeville, Tennessee. And next slide. West Orange, New Jersey plans to expand their co-responder program and bring together West Orange Police Department and Mental Health Association of Essex and Morris counties. Tropical, Texas will enhance the local mental health law enforcement co-responder team program. And finally, Tucson, Arizona will launch community assessment, response, and engagement, or a CARE team, which will be made up of a clinician who will serve as the program manager and 2 case navigators and peers. And next slide.
All right, well, thank you, Ethan, Laura, and Deirdre. This is a really exciting cohort. Welcome, everyone. I saw folks making connections already in the chat, which is fantastic and exactly what we wanted to do to bring you all together. I am going to be discussing some technical assistance and sort of what that looks like as you all get started. I saw a few questions come in. I just want to say we are going to be talking about the P&I guide and some other considerations as you move forward. So can you go to the next slide, please? All right, thank you. So as we have shared, we're a TTA, training and technical assistance provider. And what that means in more detail, I'd like to discuss. So we've introduced you to a few TA coaches who will be, as you've heard, like your main hub for support. Someone a lot smarter than me has also called it your airline traffic controller, right? So they will be working very closely with you to help you identify additional resources and also work through any issues as you implement your grant through any of the phases. You will also have opportunities for peer learning between yourselves and other resources that we have at the CSG Justice Center. You'll have access to experts both internally and externally, and all of the resources and tools that we have developed specifically for JMHCP and Connect and Protect, as well as those that are more targeted to some of your unique issues and areas that you're working on through your grant implementation. So next slide, please. So as you can see from the slide, and we've mentioned, your TA coach is the individual who will be connecting you to resources and activities that will support the planning and implementation of your project. Throughout the entire grant cycle, each team can expect to have monthly calls with your TA coach. And early in the planning phase, you will be working intensely with the planning and implementation guide, or P&I guide as they're referred to, and you can see on this slide, which is a grant requirement. We strive to be as individualized as possible through the TA process. So your technical assistance may contain some or all of the components shown in this graphic, and they can also be modified as you go. So you might identify a resource in a few months that you'd like, or a peer learning opportunity as you implement your program that you'd like. Your TA coach will be responsive to each grantee team's unique needs and support you in meeting your project goals as well as completing the grant requirements. We can't stress this enough, that your TA coach is such an important resource. And if you have any questions that come up, please do utilize them and go to them first. They will be the ones to either identify what they can provide you immediately or where to go to get the answers. And I see a few questions coming in. That's great. Please, can you go to the next slide, please? So I know we've mentioned the planning and implementation guide, the P&I guide, but the P&I guide was created to support grantees in developing and refining their initiatives. It's also there to foster discussion on best practices, identify considerations for collaborative effort, and help you work through key decisions and implementation challenges. And especially it is there for you to understand the status and progress of your project, the types of challenges you are encountering, and the ways your TA coach might be helpful to you in making your project successful. So as I mentioned on the earlier slide, we really take an individualized approach, and the P&I guide is a requirement through the planning phase to help you set the stage and be as prepared as you possibly can so that on day one of implementing your program locally, you have everything you need. I just wanted to list out, I'm not trying to read slides, but I want to break out the areas of the P&I guide, and then we'll talk specifically about number 7, which is the technical assistance plan. But the P&I guide is made up of 7 components: the goals, collaborative partnerships, target population, evidence-based services and support, data collection, performance management, and program evaluation, sustainability, and then your technical assistance plan. So can you go to the next slide, please? So as I mentioned, the last part of your P&I guides includes questions that will help to develop your technical assistance plan, TA plan. As you are working on that section of the guide, we would like you and your team to reflect on any areas of program development where you would be interested in receiving technical assistance. You actually have 2 great resources on the call today who will be discussing their experience utilizing technical assistance and elevating the TA plan. So we look forward to hearing from them, but some areas of technical assistance would be refining an evaluation plan, training and supervising staff, developing a process to be used for case planning, identifying sustainability strategies, and such on. You and your team will then work with your TA coach to develop the full TA plan to include goals and action steps to help the grant program move forward, meet deliverables on time, and highlight unique aspects of your work. Throughout your grant, you and your TA coach will work to review and update your TA plan. As we mentioned, we have a wide range of resources that we at CSG and your TA coach can connect you to, and sometimes those will change and grow, and you'll need to add more, hear about different programming from the communities of practice, hear about different areas you'd like to learn more, and your TA coach will be, through the TA plan, will be able to help identify those and outline the steps that you need to be able to receive that support. All right, next slide, please. So I'd also just like to highlight the communities of practice. For those of you who have been JMHCP grantees in the past, they're sometimes referred to as learning communities, but we are now building communities of practice. We will be hosting, along with BJ, 5 different communities of practice in conjunction with subject matter experts in the field. Communities of practice are smaller. They're more interactive training events that offer opportunities to connect with and learn from peers and experts in the field. There are 5 focus areas for the communities of practice, which include Intercept 0. And this is designed for Connect and Protect grantees and will cover community-based support and crisis services. Intercept 1, which is also designed for Connect and Protect grantees and will focus on the role of law enforcement in crisis response and services. The 3rd is gender responsive services for women, including the specific needs of women in the justice system. The 4th is data collection and information sharing community of practice. Topics will be directly related to grant project work. They'll be explored such as how to collect accurate program data, how to use this data to evaluate program impact, and how to use this information to make continuous quality improvements. And finally, we'll be having the 5th community of practice will be focused on addressing the needs of rural communities. We know that rural grantees have a specific set of challenges they're addressing, and we look forward to learning more about those and providing additional resources and support during that community of practice. Next slide, please. So a few things to note about the communities of practice. The communities of practice and sessions will be open for all grantees. All grantees will receive a registration link at least 3 weeks in advance of the community of practice. All interested grantees must register for the community of practice within 2 weeks. You can also, this will be another opportunity to ask questions and discuss closely with your TA coach about which ones make most sense for your grant needs. And then all registered grantees will receive at least a week before the community of practice the offline work assignment to be completed for the community of practice discussion. While each community of practice and sessions are open to all grantees, it is highly recommended that grantees complete at least one entire community of practice series. So as you can see on the slide, one key component of this work is that it is interactive and engaging and builds the community of you all as a cohort. This is an opportunity for peer learning and networking, bringing in subject matter experts to share targeted support and advance your programming. So next slide, please. We also just wanted to share a bit about a potential upcoming JMHCP grantee convening. It will be a virtual event held in July, date TBD, all FY20 and FY21 grantees to attend. There will be topical plenary and breakout sessions. And of course, there'll be connections with peers and experts, again, both internally at CSG and externally. Next slide, please. Okay, well, it is my great pleasure to turn it over to discuss and to share their grantee experience. I cannot say thank you enough to Jenna and Peggy for joining us today. Throughout this process, it's been great to learn more about your programming, but I will stop talking and I will turn it over to them. As I mentioned at the start of this webinar, we were very lucky, and I would like to start it first to turn it over to Jenna, who will share her experience from Boston Police Department. So with that, next slide, and I'll turn over to Jenna.
Good afternoon, everybody. I will talk fast, so tell me if I need to slow down. And I will also have slides that I probably won't even mention anything that's on them because I like to just talk off the top of my head. But I will say, yes, Boston has been getting JMHCP grant funds since 2010. We received the FY10, FY13, FY16, and FY19 Justice and Mental Health grants. We did apply for FY15, did not get it, and we don't talk about that. But you know, these grant funds have been critical to our entire mental health response in Boston. I can say that starting in 2010, we started getting a combination of these grant funds and State Department of Mental Health grant funds. And these are what really got our co-response program up and running. The co-responder started with DMH grant funds, but very reluctantly, the state did not really see co-response as a best practice and kept pushing for CIT. So it was truly our federal grant support for this what DMH saw as a more innovative program. And so it's amazing to hear about all these grantees on the call who do co-response. Like the federal government was always very supportive of this as a program, and it really helped us throughout the years when DMH was kind of giving us a little bit of pushback, and now they love it. So we've had all these grants. Our main mental health partner, so I'm the Deputy Director of the Office of Research and Development at the Boston Police Department, and we partner primarily with Boston Emergency Services team out of Boston Medical Center. They're the local emergency services program. And prior to our first BJA grant, they really just had a very informal relationship with just a few of our officers who were focused on homelessness. But they came to us, I can still remember the day they came to our office and said, listen, we're gonna propose that we apply for this grant together where you have to be the applicant, but all the money is gonna come to us, but we promise you it will be worth it. And it's been kind of going ever since then. And so we first used our federal grant, the BJA, the FY10 grant, just to make sure our officers knew that BEST existed, because so many of them didn't. So we created an e-learning program through our academy that to this day is still mandatory for all of our officers. And I starred in it, and it's really embarrassing, but that's my mark on this department. But you know, it really did get the word out just about who is BEST, when can you contact them, how can you contact them. And the grant funds also were aimed at helping us to expand the availability of the BEST 911, their call center, which is 24/7 available. So that was before we even had our first co-responder. It was just literally getting the word out about BEST, and it was so important. For our FY13, by the time we got that grant, we did have our first co-responder through state grant funds. And so we were able to use our FY13 BJA grant to hire a second co-responder, kind of really making it officially a program. We didn't just have one anymore, we had two. So you're able to expand that program. And we also had aimed to use our FY13 grant to kind of force us. We thought that by putting money on the table, we would maybe be forcing EMS, because at the time, BPD and EMS weren't really talking much about mental health. And we thought this would be a great way to kind of collaborate how you respond to the high utilizers. Of course, we're all seeing the same folks. I'll come back to that in a second. Then our FY16 grant continued. I think we lost a clinician, so we had to rehire one. So we were continuing to maintain our co-responder program, but we also were able to use BJA grant funds to hire an evaluator for the first time, who we still partner with very, very closely, and also to do something really innovative, which was a dedicated car pilot, which I'll just briefly say, because I know it's not the point of this, but currently our co-responders ride just with regular officers. We're part of regular minimum manning. So if something else happens, they have to go to those calls. And we just had a sense that what would it be like if we actually just had mental health cars that were dedicated to our co-responders. And of course, we found that it was phenomenally helpful, especially with proactive calls and proactive involvement. And then finally, things kept changing in Boston. In FY19, we by then actually had City of Boston operating budget funds to support our clinicians. So we no longer needed the grant funds to do that. And I'll talk about that too. So we wanted to instead improve our data tracking. And we by then had taken a trip to Houston and saw how they did their data. We wanted to do better. And that was because of CSG that we were able to do that site visit. And we also wanted to pilot a citywide outreach program, which ended up being unnecessary because one got started by itself. And we wanted to implement telemedicine, and that was before the pandemic started. And things ended up changing dramatically with that as well. So lots of changes, but these were the goals of our 4 grants. And I will say next slide. So as far as the outcomes, started out kind of on track as far as we did indeed with our FY10 program. We did community learning. Again, that's still available to all of our officers. We did indeed expand our best call support center. FY13 made some minor changes. We did hire a full-time best clinician who was initially hired for one area of the city, but things changed. We realized that the need was greater in a different area, and we worked with our TA support and our federal grant manager to change the scope and move that clinician to a different area of the city. But I mentioned the EMS thing because this was a lesson that we learned. And I know it's too late because you've all gotten your grants already, but this is where I learned, don't put something in a grant that you can't, there was no need to put something so complicated that really didn't need funding into the grant. And so I was constantly for that entire grant period letting down my TA provider. They would ask about how things were going with EMS, and they weren't going. We just couldn't get the right people at the table. So we never really got traction on that part of our grant. And it was great that the grant kept us, made us keep trying, but we really didn't get anywhere with it. And there was really no need for it to be in the grant. So that was just an interesting lesson learned. FY16, we did indeed replace our area C clinician. We were able to do a dedicated car pilot. We were able to do an evaluation with our academic partner. We've gone to conferences. We've published on that. It's great. FY19 was when the pandemic came out. George Floyd happened. We also got a new citywide outreach unit, regardless of the grant. So we had to make a lot of changes there. And the grant was super great about being flexible. And so we've made a lot of changes, but it was hugely helpful. And that led us to our most recent Connect and Protect grant, which is now focusing primarily on voluntary site commitments. When someone is deemed a harm to himself or others, you can have the police, doctors and social workers, also officers can fill out these things called Section 12s in the state of Massachusetts, where someone can be brought against their will to an emergency department to be evaluated. But especially given anti-police sentiment these days, it's a very hot topic of what happens when police do force someone to go to the ER. Should they be able to use their discretion when asked or essentially told by doctors to do this? And our street outreach unit is kind of coordinating that process, and we brought back our evaluator to look at how we're doing this and track the data. And this grant fund is helping us to hire a much needed Section 12 coordinator position. So it's amazing that these grant funds just let us keep making the case to get permanent funding for things, and then to continue to allows us to be innovative with each progressive grant. So it's been a phenomenal experience, and shout out to Laura and also Ethan, who I've worked with. Lots of different TA providers over the years. And I was resistant at first, I'll be the first to admit it, but it's been incredibly helpful, and we'll talk about the TA stuff more later, but that's been the Boston experience. Sorry if I talk too fast.
Thank you, Jenna. Thank you so much. I see some questions coming in, but I want to give time to Peggy to share her experience. But thank you, Jenna. And Peggy, with the next slide, we'll kick it over to you.
Hi, I'm Peggy Heil, and I work at the Colorado Division of Criminal Justice. And we started our project a little bit before the FY19 grant opportunity happened. I was on a state committee, and the defense attorneys were saying that there were a lot of 911 calls that ended in felony for assault charges. So regular responders went to the scene. It was just a welfare check, but they realized the person needed to be brought in for a mental health hold. Person was psychotic, resisted, and next thing you know, a non-criminal event was ending in prison sentence. So we wanted to get ahead of it, and we had brought our public safety answering points, which is what they're called in Colorado. Those are the 911 emergency communication centers, and looked at what could we do to try and intervene differently to reduce those criminal justice outcomes. And right as we were starting that, the JMHCP grant opportunity happened. And so we applied and were awarded one in FY19. And we did a no-cost extension. So we're in the last year of that grant. But we did a lot of planning there. So we applied for the next grant as well. So it really was, it's a statewide project to see if we can develop alternative responses to those behavioral health involved 911 calls. And we wanted to integrate behavioral health services into the responses. People in the planning group wanted a culture change to have behavioral health as a fourth component of emergency responders. Weren't quite able to do that. But then we also wanted to finish with a connection to services. So if people were called out, a lot of times, when it resolved, they're left with just contact your therapist. If they didn't have a therapist, it just, that crisis situation continued. So we wanted to make sure that people had that connection to services. So if you go to the next slide, what we did in our planning grant is we looked at all the possible ways that you could add behavioral health response to emergency response. And we flowcharted that, and you can see that on the right. I'm sure you can read all of that very clearly, but we're making that available on a website so that jurisdictions can consider all the different ways that they can put responses together. Then we surveyed the state and we tried to identify where there were specialized responses and map those. But we also are modeling after the Council of State Governments, BJA peer learning site model to create state learning sites. And so we're mapping those as well. And then we wanted to make training on behavioral health issues and wellness more accessible for community, for the emergency centers. So in Colorado, we have 92 different public safety answering points, and some are in frontier areas, rural areas. They had a lot of difficulty getting training for their staff. And so we made some web-based and accessibility to training. And then we're in the process of developing a planning process tool that any of the jurisdictions can use that suggests who you bring to the table, review the different types of options that might be available, have them select what works best in their community, and then give them information on learning sites, protocols, and funding sources that might be available to them. And so that's pretty much what we're doing in our grant. And the next grant is to actually further all that work and expand to additional training. And we want to do a peer navigator model for the post-crisis connection to services. So next.
Thank you, Peggy. Thank you so much. It's excellent to hear all of the great work that you have done throughout the years, both in Colorado and Massachusetts, and we're able to leverage the funding to plan and implement it. I know I speak for all of us when I say that your advice and perspective is so important. So with that, before we get to Q&A, I wanted to open it up for a panel discussion. Here are the questions we're going to be talking about today, but of course, if there's anything else you'd like to share, we'd welcome that. So I know, Peggy, you sort of touched on this about your planning process, but it would be great to share with the other grantees that are on the line today. How was TA most beneficial to you? How did you leverage TA to advance your program goals? Could you share a little bit about that?
Sure. Ethan is our TA provider. And so we did, besides just discussing our progress and barriers and getting his advice, he is very knowledgeable about, the broader programs that are out there in other states. And so he could give us information about, areas that were ahead of us and what they might be doing. And many times he arranged for us to have meetings with people that had already worked ahead on some of the issues that we were trying to figure out. And that was really helpful. And one of the, I would say, most beneficial things that happened in our TA, and it kind of goes down to question 2 as well, is part of the expectation was that we would visit a learning site, and we had 2 people that we had picked out that were going to go, and they were just in the process of making arrangements with Houston, and COVID started to ramp up. So we canceled those plans, and Ethan actually arranged and moderated a virtual learning site visit with Houston. And we were able to get all of our task force at the learning site meeting. And they invited their administrators, and we had a county attorney involved. And so it really generated a lot of enthusiasm and support for the project. So that was really beneficial to our program.
Thank you, Peggy. Yeah, and it seems like as your program goals are to create state learning sites, that experience is really pivotal. So that's fantastic. Jenna, from your experience implementing quite a few grants throughout the years, we'd also like to hear about how TA has been beneficial to your programs, I should say, and how you've utilized TA throughout the years to advance your project goals.
Sure thing. It has been great in several different ways, I would say. I think it's great to have a third party. Obviously you have a direct relationship with your grant funder, but it's always good to have a third party for helping things move smoothly and triangulating and getting things done, because obviously your federal grant managers have a lot of grants that they manage. So it's great to just have a third party that can help you get revisions done and kind of help that communication. As Peggy mentioned, the site visits, and Houston in particular, I can't speak highly enough about their program, but we learned so much from them. We also sent folks to Los Angeles. In the very beginning, we had folks come down from Portland, Maine. So we've learned a lot from these visits, and we're also ourselves trying to be a CSG learning site. We applied once. I'm so glad we didn't get it. We weren't ready, but someday we do aspire to that. We love the peer-to-peer learning. And just in general, great about sending, there's never any need to reinvent the wheel. So if you need a template of a policy, or pretty much you name it, or, we have this problem, how do other places handle it? Your TA providers can actually answer those questions for you and put you in touch with the right people. And that's just invaluable. And another thing, the final thing I'll say about the benefits of it, it truly, it's very easy to forget, at least for me. I wear a lot of hats here, and grant management is one of those things I can easily overlook as far as just making sure I remember what I said I would do in the grant application, and remembering what our stated goals are, and remembering what our stated objectives are, because we did get grant funding and we are responsible to the federal government. And so these TA calls, which again, I was very resistant to in the beginning, really help you keep on track for what you said you would do and remember what your stated goals are, and remind you, oh, well, actually we need to do a change of scope. But it would be very easy to kind of get far afield from what you said you would do without that kind of constant reminder of what you're supposed to be doing. And again, changes are always okay, but then you make those changes. So I feel like TA is really helpful for just that constant reminder of like, do that part of your job. So I would say all of that.
Thank you. Yeah, and I think that pivots well into the next question, because I know not only did both of you have grants that were being implemented during COVID, which had to switch for a lot of reasons, but Peggy, you had mentioned this, that you had originally set aside funding in your grant to travel to visit a learning site, and then you had to change. So I know you had spoken a bit about the changes in your program, but can you speak a little bit more about how you utilize TA and how you made those changes and continue to implement the program and still meet your project goals?
Yeah, I think the virtual site visit was a great way that we use TA to try and figure out how to do that. And we were constantly, as we had new ideas come up in planning, kind of running some of that by Ethan and finding out the additional programs that might be ahead of us on that. In our project originally, we had this concept, and that's, the planning, things really evolve. We had an idea that we could come up with one statewide protocol for identifying mental health involved calls that could be transferred to our crisis line. And we picked a rural location and an urban location to go ahead and implement the pilot program. And our rural program went back to their board and found out all the ways that we were thinking that wouldn't work in their area. So that's kind of where we morphed into trying to figure out more flexible options for people to add behavioral health components to their responses. And it's just as you're doing that and developing those tools, taking advantage of the TA is really helpful, because even doing our web page, I was able to ask Ethan about some of the tools that Council of State Governments had developed and get advice on how we might do something similar where we were and how we could implement the learning sites, because that went with doing more diverse options for people. So those are just a couple of the ways that when you write your grant, you just have a short time period to do it. And you put, as Jenna was saying, you put goals in your grant that as you start working on it, maybe you can't quite do what you originally thought, and your budget, you're guessing at that point. So it's, I think, having that flexibility and being able to get some advice around how to accommodate things is very useful.
Thank you. Yeah, I mean, Jen, I'll open it up to you too if you have anything else you'd like to add on that, how experiencing and changing, utilizing TA to continue your program goals.
Yeah, I'll just say, especially again during that FY19 award, when the world was changing, the BPD was changing, our mayor changed. So many things were in flux, for better or for worse. And I think having those regular TA calls, just gave some semblance of normalcy throughout the craziness, but also it helped alleviate some stress because we really weren't, I don't know if we did anything we originally set out to do with those grant funds. I think almost everything changed through the course of that grant. And it's what led us to this amazing Connect and Protect program. And so the ability to change and flow with things, but to know that, okay, I've definitely let our TA provider know what's going on. And just to get that advice of like, at what point do I need to do a change of scope versus not? And just discussing those ongoing changes. It was just really helpful. And we still were able to spend down our funds, but just adapted to so many different changes across the way, and really helpful to keep just talking to Laura throughout, and occasionally Ethan too, just to help us kind of figure out what changes we needed to really hone in on or not, what we needed to let BJA know about. So yeah, just the flexibility was fantastic and the support.
Thank you. I mean, I think we've talked about this, but how would you recommend new grantees utilize TA? But as new grantees on the call, because there are two specific phases, right? The planning, and then you move into implementation. I wonder if each of you could share like maybe one or two highlights or like things that if you could go back and tell your older, your past self, as you enter into the planning phase, this is the way you should specifically utilize TA. Is there anything else you'd like to share? I mean, you've talked so much about it, so but that you would encourage folks to be particularly mindful as they move into this planning phase. Anything you'd like to share? I guess, Peggy, I'll kick it over to you.
So we have a state project. So a lot of the questions in the planning and implementation guide were difficult for us to answer. And so that was another way in which we utilized TA, is to try and figure that out. And then, I'm looking at your list here, the communities of practice, being able to find out about those, make that available to some of our task force members as well to attend, continues to keep people enthusiastic about the project. And it's also a good way to learn what other programs are doing, although Ethan has been an incredible resource to figure out who's doing what we want to do and could give us advice or talk about their experiences. So I think just if you have barriers or you have questions, even during the time period of that grant, I think it was harder to access your BJA grant manager. I think they had some staffing issues. So even being able to run that by the TA provider with your questions is very useful and helpful.
Thank you. Yeah, Jen, anything you'd like to add?
No, I mean, I think, the TA calls, you can be flexible again, if trying to figure out what's going to work best for you. I suspect in the beginning, especially if you're a new grantee, maybe the calls will be bi-weekly, but it's nice that you can always just be open and communicative with your TA provider. Let them know if you're meeting too often or not often enough, or hey, you know what, my hands are full this month. Can I send you a written update instead? Just all those kind of flexibilities, and because your degree of need will change throughout the life of the grant, and especially in the beginning, I imagine there's a lot more questions, and again, templates and things and what other places are doing. I suspect you'll meet more frequently in the beginning, but then you can kind of figure out what pace works well for both ends. And I think good to meet via Zoom in the very beginning, at least, to get to know each other's faces and have it be a little bit more personal. Yeah, I think that's what I got for that.
Yeah, thank you. And the last question, although I do just want to emphasize, like, this is a conversation. So I encourage anyone to send any of the participants to send questions directly in the chat, or I think, for both Peggy and Jenny, you can send them direct messages through Zoom, but I'll definitely open it up in a moment. But a lot of the Connect and Protect cohort have in their grant goals is to hire additional individuals and to support their programming. And I know that nationally, the conversation is definitely that hiring has a whole host of challenges, and especially given the transitions that we're facing as a country, there are continued challenges. So I just wanted to open it up to see if either of you had any advice. And Jenna, I'll start with you. Advice for grantees that will plan to use their funding to hire an individual to join their team, whether it's like a brand new position or filling a back, like adding additional salary. So Jen, any thoughts?
100%. Yeah. I mean, so initially we were using these grant funds to support a clinician position, and that came with serious challenges. When the grant expired, we lost someone really valuable, and we're never able, we lost them and had to replace them. And there was obviously A, gap in services, and B, just loss of someone who was really valuable. What I will say is nothing speaks louder than data in making a case for the need for a position. So that evaluation component is critical. Having data, if you can do a cost benefit analysis. What we essentially were able to do in Boston is kind of transition from using grant funding to support these positions to using our data to make a case to city council. And as it turns out, we had a fatal incident. That's what kind of brought the attention of mental health and police to city council's attention. But then we were able to make the case to our local politicians of this is a program we have, and yet we only have grant funding to support these positions. The city should invest in them permanently. And so we were able to make that transition and then expand since then to get permanent operating budget funds to support initially 2.5 best clinicians, now up to about 15 or 16. And so, even during the defund police movement, funds were being taken away from BPD overtime, but being increased in our clinician position operating budget funds. And so having that data, again, if you can do a cost benefit analysis, even better. But yeah, grant funding to hire positions is really hard. So again, we're using this new grant to hire a Section 12 coordinator. I have no doubt that our street outreach unit is going to need that position permanently. And I have no doubt that we will find a way to hopefully at the end of the grant cycle, make it permanent. And we're fortunate again to have a really good investment from city council. Like I think we'll be able to make it work. But it's good to be upfront with people being hired through grant funds. At least this isn't a one-year program. So, at least it's 3 years, but it's good to be upfront about the fact that grant funding comes and goes and you're only guaranteed a position for a few years. But yeah, making the most of your evaluation to have data make the case for why the city should invest it, or the state or the county, is really your best way for kind of transitioning from grant funding to permanent funding if you can.
Thank you, Jenna. Yeah, that's really helpful perspective. Peggy, anything you'd like to add to that around hiring and how to transition that?
Well, we didn't hire anybody in our first grant, and so we'll be dealing with that in this next one. So at this point, I don't have anything useful that I can tell you.
Thank you. Yeah, I mean, and again, like this is the opportunity that we all get to learn from each other. So Jenna, I'm sure you will be getting lots of questions from folks that are going through that, but thank you for sharing that. I just want to take a pause to see if anybody else had any questions. We're about to turn into the full Q&A opportunity to talk about the Connect and Protect grant in broad detail, but I wanted to see if anyone had any questions for Jenna and Peggy. I believe Maria Ramirez, have your questions been addressed around a link to the Colorado program? Yes, thank you. Thanks. All right. Well, as we transition to the Q&A, of course, if there's anything, you can go to the next slide. If there's anything that comes up we'd like to talk about, I certainly do so. So now you can go to the next slide, please. So we'll be discussing Q&A. I'll be facilitating the conversation. Again, you can put your questions in the chat, or you can go to the Q&A, the open opportunity. And then we can just click through these next slides, but I did want to share for the next slide. This is our contact information. You can always reach out to me, as I'll be overseeing the grant track, and Demetrius Thomas, who's overseeing the full programming here of JMHCP at CSG, as well as Jenna shared her information. And of course, to the next slide, please. Here are some additional resources we just wanted to elevate to your awareness. And like I said, this webinar will be recorded and shared with you afterwards. So don't feel that you need to rush and like screenshot these or anything, but this will be an ongoing resource you can refer back to. Next slide, please. And then I really encourage you all to join, if you haven't already, the monthly behavioral health newsletter. This is a really fantastic opportunity to stay up to date, not just with Connect and Protect and JMHCP, but all of the additional resources that CSG can provide you. Next slide, please. All right, thank you. So let's just pause here. I will take a moment to answer any questions. And again, we have a whole host of individuals on. So if there are other things you want to ask from more folks, please do. I think someone earlier asked about the P&I guide. So if you have any more questions about that, happy to answer, or just going through the chat. Oh, it's so great to see everyone's welcome. So really glad to see you all here. So Maria, I will actually turn this question over to Demetrius. Demetrius, Maria asked, are we getting the P&I? So this is Maria Ramirez asked this question. I'm sorry, I know that there's multiple Marias on the call. Demetrius, Maria Ramirez asks, are we getting the P&I documents for the TA person? So Maria, I'll leave it to Demetrius to add anything else, but you should be getting the P&I guide, the updated P&I guide to work on with your TA coach, who you will be assigned in the next coming weeks by the end of this month. So you will be working on it with them. Demetrius, is there anything else you'd like to add to Maria's question?
No, I think you got it. I think it was. I think it's, are we getting it from the TA coach?
Oh, okay.
And when you, I think I could be wrong though. But I think the answer is traditionally we want you to have the next steps will be you will be having your first TA call with your assigned TA coaches, and when you have your first TA call with your assigned TA coaches, they will be going in depth about specific things they will be providing you. One of that will be the P&I guide. Hopefully at that time, if it's closer to the end of March, your TA coach can provide you directly with your P&I guide. If your actual TA coach first call is before the end of March, then it's likely that they won't. But to Julia's point, the P&I guides will definitely be available toward the end of the month. And if they are at that point, you can receive them directly from your TA coach. But if not, we will have a process to get it to you as soon as the P&I guides have been finalized.
Thank you, Demetrius. Maria, please. Okay, great. Thank you. We also just wanted to open it up and get Peggy and Jenna's thoughts, but who would you advise making sure is on the TA calls? We want to make sure it's reaching the right audience to move the programming forward, but from your experience, who did you have on the monthly TA calls with your TA coach?
So I can go first. I mean, I think having, for us, since it was always really focused on the partnership between us and our mental health partner, usually it would be at least myself, someone from the mental health partner, and usually our academic evaluator. She was always there as well, usually. And then sometimes someone sworn as well, if I could get them to come. But, you know, I think having someone from each major partner agency is really helpful. Because they're going to be able to help. They can report out directly on stuff that you may not even know yourself. And again, it's just, I think it helps keep that partnership on task. And if you don't happen to have other outside meetings, you know, if you don't have stakeholder meetings regularly, then it's, that TA call is a good opportunity to really kind of catch up with each other and see what's going on. So yeah, I would say someone from each major partner.
Yes, yeah, and Jenna, thank you so much. I should say, as part of the requirement of your grant, because this is a cross collaboration program between law enforcement and your mental health provider, I cannot, reiterate that the expectation is that you would have a representative ongoing from your behavioral health and mental health service provider, as well as your law enforcement. I think that's a really good reminder that this is an opportunity to, when things are so busy and there's a lot of things going on, this is the monthly TA call, in addition to many things, is an opportunity for you to get together and reconnect, and especially over Zoom, see each other's faces. But Peggy, any additional thoughts or advice?
We had the people who were most involved in planning, kind of like the planning team. We have a much broader task force that meets monthly, but we had the people who were most often facilitating activities and leading groups involved. And one of the unfortunate things for us is there's a Colorado 911 resource center, and we had the director of that center involved in our TA calls. And unfortunately, their funding decreased, and that person's no longer in that position. So we've got a little bit of a gap there, but it would be better. We were trying to get the key people in each of the areas that we're trying to get planning in the TA meetings.
Okay, yeah, thank you, Peggy. That's very helpful. We received one additional question, and Demetrius, I'm going to turn this over to you. Can we start our planning process if we have to do RFPs to determine a contracted provider? So I'm assuming that would be a contracted provider kind of beyond the initial grant partnership. But Demetrius, that's also another question that you can work very closely with and coordinate with your TA coach. Just want to emphasize that as well, but I'll, Demetrius.
I'm not sure, Anna, can you repeat the question?
Can the program start their planning process if they have to do requests for proposal to bring on an additional partner for implementation?
Yes, they can. They should be starting their planning process. They're now in their planning stage of their grant.
Great. Well, there you go. That's perfect. And again, that's an opportunity in which you can engage your TA coach, who can provide templates. I think it was actually Jenna who mentioned earlier, we can bring, and the TA coach will share with you many templates and examples and learning opportunities from other sites who have worked through similar, for example, working on contracting. Any other questions?
I have a question that I think the participants may find useful, and I'm going to direct it to Jenna. Jenna, you talked a bit about a lot of the things that you have put in your original grant response solicitation you ended up not doing, and then you talked about doing the grant GAN process and changing it. Can you drill down a bit more just how that process looked in terms of when you had to do that grant adjustment modification, and how did you work with the BJA? What were some of the timelines? Just because that may be true and consistent for some of our participants on the call now. Just if you can give some specifics of how you all manage that process and logistics.
Sure. It's obviously going to be harder moving forward because it'll be through just grants, which I'm still not really great with. But when it was GMS and life was a little bit sweeter, we would, anything that's a major change of scope, you'd have to do a change of scope GAN. Federal grant manager needs to approve that. And so you need to submit in writing what you want your change of scope to be and why. And it can be quite a timely process. Again, like the TA can be helpful if you're not getting quick responses. But once you get that change of scope, you can then do a budget revision. And that's also complicated because you get it, for us at least, you have to do a federal budget revision first. Complicated depending on whether you're putting funds into an existing budget line or you're creating a new budget line. Complicated then because you get the approval from the feds, you then have to do, on our end at least, internal budget revision. Also, if it's for less than 10% of the full grant amount, you can do an internal budget revision without getting federal grant approval. So this is the part of the job that is extremely confusing. We have a grants manager in my office, who I'm constantly bombarding with questions about this stuff, but it's timely. It is exactly why I think TA meetings are helpful, because it's easy to forget to do these things. The budget revisions are really important. Staying on top of your budgets, checking them monthly. You know, we get from our finance. So at the BPD, we have our grants office, which is me, and then we have a finance department, which is separate. And we get from them every month a grant summary. You know, like, here's what's spent down, here's what's in each of your budget lines, here's the balances, here's where things are at with your contracts. And you also have to establish subcontracts. And depending on the amount of that, you might have to put it out to bid. So it's all very complicated. So kind of staying on top of those more administrative tasks is easy to overlook and not want to do, but you have to. So getting a monthly budget summary is extremely helpful to see what contracts are being spent down, what's not. You know, you're going to have quarterly progress reports. You're going to need to get data from your partners. So staying on top of these things, I highly recommend putting reminders in your calendars every quarter that, oh, your reports are due, because again, that's the kind of stuff that's easy to forget. But the budget revisions, don't wait till the last second. You only have a certain amount of time before the end of the grant. And getting the federal response can be quite timely. So you need to kind of plan for that. And yeah, I don't know if that really answered the question, but just lists on lists on lists for me when it comes to this stuff, to remind yourself to do the more administrative housekeeping things when it comes to grant management. It's the non-sexy part of all of this, but it has to get done. It's really important. And so if this is your first federal grant, or if you're not familiar with this, very helpful to introduce yourself to your finance people, to other grant managers who might be working in your department. Because you get the hang of it, but there's just a lot of moving parts.
Thank you. Yeah. The many moving parts. Absolutely. It's an ongoing process. This is another question. I think, you know, Jenna, I definitely would like to hear your perspective, because you brought on an evaluator, as you mentioned in your programming, but I'll also turn it over to other panelists who may have thoughts as well. But do you have any advice and input on when grantees should have their evaluator join in on the project, but also should they be on the TA calls as well? Any thoughts? And then I will also turn it over to others if they have any feedback.
So we've had one main academic partner, who is Dr. Melissa Morabito out of UMass Lowell, since, I guess since 2016, but I've been working with her since about 2012. I love to have her in every call. She's willing to come. It shows her investment, even if there's nothing to report out. She has made herself available to us above and beyond. Even if there were no grant funding, she is so eager to help us, and that relationship is so helpful. And again, lends some legitimacy to have data and have a third party look at that data and give us results that we didn't just do ourselves is super helpful. So I do encourage not only having them on the call, but I do think bringing them in as soon as possible, depending on what you're evaluating. If you haven't designed it yet, they can help you design it. They can help you figure out what baseline data do you need, what should your pre versus post period be. And that's what academics do. And so I feel like the sooner you bring them in and kind of expand on that relationship and deepen that relationship, that is one of those things that ideally will go beyond the life of the grant. Once you found a good academic partner, again, publishing, I'm going to Las Vegas next week to present on some stuff we've done. It's just, I think that relationship is incredibly important. And again, especially for making that case for moving from grant funding to permanent grant funding, to permanent operating budget funding. So I do think bringing them in from the beginning, getting their input, and having them, if they haven't worked with law enforcement before, that's a whole new culture shock that might be, gaining that trust with civilians and with academics. It could be a matter of worlds colliding. So the sooner you get people to understand each other, get to know each other, and build that trust, the better. So yeah.
Yeah, that's so helpful. And I think, as you said, build that long-term relationship. And also one thing we will say is, as the TA coaches, we can also connect other evaluators with other learning opportunities with other evaluators, right? You all are a team, it's collaborative, and it's an opportunity to learn from each other. So thank you for that perspective. And I think as folks look to sustainability, which I know is a key component of all of the grantees, everyone on this cohort and broader perspective, your feedback on like thinking through the data that you can share more broadly. And often when we talk about transitions, we may also be talking about local transitions in leadership. So having that data at the beginning and involving that evaluator in your experience led to really great outcomes. And so thank you for sharing that. Anybody else, any other thoughts on the evaluator and when to bring them in? Okay. So I will keep going. Let's see. So this is one question that sometimes comes up, and it's a little bit more administrative. So I guess I'll turn this over to Demetrius and then Maria Fryer if you have any thoughts. But how do we change the point of contact for the grant?
Yeah, I wouldn't know that question. I will answer to that question. I will have to kick that over to Maria.
Certainly. So again, this is where you're sort of knowing who your grant manager is or your state policy advisor. Sometimes they're referred to as a state policy advisor. You'll hear SPA, or something like that, just so you know. But that is the person who will help you to manage your project and your budget specifically post-award. They are like in BJA, we have the policy side, which is the programmatic and the kind of the pre-award side, and then the more of the working with the goals and objectives and sort of reaching, your plan, goals and objectives of the program. And then on the program side, the programs office is going to help you to make adjustments in just grants. Maybe it is the program contact. It's the authorizing official, how to assign roles and things like that in just grants. Excuse me. Talk today. But in just grants, there is a number of tutorials that I would encourage you to take advantage of that really walk you through making some of those changes. Having your contact information, making sure that is up to date is really critical, because we've had a number of occasions where someone might be saying, I'm reaching out to my grants manager, I haven't heard back, or I haven't heard from my grants manager, or and that all comes down to a lot of times to contact information and just keeping that current. So just want to encourage you to do that and know that your grants manager is like your first point of contact when it comes to budgetary questions and anything financial, major programmatic changes and things like that. And so, I know we heard a wealth of experience from practitioners in the field that are doing the work, and they spoke to that the process can be complicated, and we just want to make sure that when you do that you kind of know the steps and you do it one time and you get it done, so that you can reach your goals and objectives. So those two pieces kind of go hand in glove there, and really important to have a good grip on the management side. Good question.
Yeah, thank you, Maria. And I want to just emphasize again that we will have, I know there were 2 previous orientation webinars that go into a little bit of this as well. So just as resources, if you, in the next coming days, as you're digesting all of this, would like to look back at those resources, those will be up and ready for you to share. We had 2 more questions just as we close out. I want to make sure we get to them. So the first is, if we have a current BJA program, can we apply for another BJA grant this year for service in the next year? This would be for a separate program from the current program. I will turn it over to Maria to answer that question. Let me know if you need me to repeat it.
Sure. So I think I see it in the chat, and you can apply each year that the program funding is available. We're getting ready to post really soon. I would say just kind of keep your ear to the ground with BJA and CSG's website and that sort of thing over the next couple of weeks. And we're just looking for strong applications. if, FY22 funding helps you to grow and enhance and improve what you've learned already through JMHCP or Connect and Protect, or builds on any of those activities, certainly apply. And, we're just looking for high scoring, strong applications, and you can totally apply again.
Thank you, Maria. And then the final question I'm actually going to ask, what can Maria Ramirez in the chat just clarify what UEI is? The question, oh, thank you. So, and I believe this is also a question for Maria Fryer to answer, but the last question from Maria Ramirez is, do we need to make any changes to our information if we received the unique entity ID? I saw it was required for the new grant applications, but it is required for those of us with a new award.
So I believe that was, that's one of the new policy regulations coming forth. I think it begins April 4th, if I'm not mistaken, if this is what the reference is to. But again, I would say check the Just Grants website and direct that question to your grants manager. I would not want to answer incorrectly or, misspeak. So you can forward the question to me at maria.fryer@usdoj.gov, and I'll be happy to pass that along to your grants manager from me so that you get an answer pretty quick.
Thank you, Maria. Well, with that, we are at time, and I just want to say thank you so much to everyone for joining, to all of our panelists, Jenna and Peggy in particular, and Maria in particular, for joining and sharing today. This webinar will be recorded, and we look forward to working more with you as the Connect and Protect community of practice and grant track and throughout all of our communities of practice. So thank you again. You have our contact information. Please do not hesitate to reach out if you need anything or have any further questions. So thank you, everyone, and have a great rest of your day.